Well, a couple of subjects that are not always a lot of laughs to talk about, but we try to take care of you on the Arizona Daily Mix, and we're doing it today in this segment, having talked in just a few minutes ago about a very serious medical problem. Let's talk about another one that doesn't necessarily have to be as serious as you might have thought. We're talking with Dr. Stephen Wander during World Alzheimer's Month, September. The Integrated Health Center of Maryland, and I thank you for visiting us after having talked about prostate cancer. Now we're talking about Alzheimer's disease. People give up often on both of them. Is there treatment that causes us now to be more optimistic?
Well, it's great. Now, before 2014, there was no workable treatment for Alzheimer's. Basically, person was told, get your affairs in order, get a power of attorney, and all of the treatment was actually for the caretaker and not the patient. And the FDA has not approved a drug since 2003 for Alzheimer's. So, I always tell people, think about if you have kids or grandkids, how old were they in 2003 versus now? But in 2014, there was a protocol that was introduced out of UCLA and is now 92% successful in actually reversing Alzheimer's as long as the patient isn't too far gone.
What do we ask for when we are looking for that treatment when it comes to its application in our lives?
Well, there's not a lot of doctors across the world doing the treatment. So, for instance, a lot of people think that aging is a normal thing in life, and it's actually not based on all the research. I was just speaking at Harvard a couple weeks ago, and George Ross from The Apprentice, over 90 years old, sharp as a tack. And some people are like, well, am I forgetting things? Like this morning, I actually forgot my tie. So is that the start of Alzheimer's, or is that just I forgot my tie? So there's actually state-of-the-art objective technology which can show, do you have shrinkage in your brain and in which areas? And it can be shown up to 40 years before actually symptomatology can take place. So
but
now,
why does the brain shrink to begin with? See, we're all confused, I think, and perhaps with the exception of you, about the cause of Alzheimer's. Is that still up for grabs?
Well, there's 7 different types of Alzheimer's, and there's different stages. One of them has a genetic component. And so before 2014, why would you actually put yourself through the problems or the trouble of getting the genetic component tested when then there's no treatment? So how is that a good way to live the rest of your life? Hey, I have this genetic component, but there's no treatment. And so now that would be one part. The brain can shrink for a lot of different reasons. In the grand scheme of things, your brain is either shrinking or it's growing. It's either getting better or it's getting worse. So there's a lot of different things you can do to help prevent it, but the first thing is to find out where the shrinkage is and in which parts of the brain.
This is a real major medical area here. We've got tremendous individual people, tremendous institutions. But if we don't have anybody immediately handy who is an authority on the new treatment that we're talking about, which is called what?
It's called the RECODE method, RECODE, reversing cognitive decline.
Well, what can we do ourselves at home?
Well, first thing that everyone needs to do is to find someone who can get them the test, because the test is the step one determining, do you have this objective data showing, do you have the shrinking? So if you don't have the shrinking, then that's not necessary, obviously. That would be the first step.
But preventatively, we all can do a few things that are fairly simple. We only have about 30 seconds.
Okay.
Run through a couple.
There are things to do to reduce inflammation. There are different types of brain activities which you can do as training, almost like computer or video games, which can keep the mind growing. Obviously, nutrition is a good part of it. Exercise can be a big part of it. So those are things that will help along the way.
When you talk to your physician, just tell them that you found out about that information from Dr. Stephen Wander from the Integrated Health Center of Maryland.